I now invite Dr. Henal Shah. She's additional professor of psychiatry at the TNMC and Nair Hospital, and she's the co-director of FEMA Regional Institute in KEM, Mumbai. And she's going to talk to us about how to assess competencies in psychiatric postgraduates. Dr. Henal Shah, over to you.
Thank you for the introduction, and congratulations for everyone for starting this ITOP, really a catchy name, and thank you for inviting me here. And I've been given precisely 12 minutes to cover something which is a very, according to me, a difficult topic of assessment of competencies in postgraduate psychiatry. So the first thing is to realize what is CBME. MCI or its new avatar has obviously moved to this new competency-based medical education, and for undergraduates, it's already become an implemented. Postgraduate, it is going to slowly happen. But it is basically an outcome-based medical education where you're more worried about not what you teach or how you teach, but what is the product that is finally available. So what can the student do when he finishes the training or when he leaves your institute? What is it that he is capable of doing? So the whole thing is around a framework of competencies which are implemented, assessed, and evaluated. So one of the most important things for this is having good assessment. So we said it is around competency. So what is a competency? A competency is an observable activity, something which you can see and which is done by a healthcare professional and which develops through stages, and it goes from novice to an expert. So when you join, you're in a novice. Probably when you leave, you may be somewhere between competent and proficient. And as you do practice, hopefully you become an expert. So that is what's in competence. So if that is what's competency, what is a competency-based assessment? The whole process of producing evidence. You need evidence to make a judgment or a decision whether a person is competent in relation to a standard. So there are three things that you have to realize. One, it is about making a decision. Secondly, whether the person is meeting standards. So these standards have to be well defined. Similarly, when we are defining competencies in India for our postgraduates, we have to be very clear what are the standards we expect our students to have, and then where we have to see when the person finishes his training or as he's training, whether he's reaching these standards that we have laid out. So this is what assessment of competencies mean. So if you look at it, if you think the person is going from novice to expert, for around 5 levels of this, then as a novice, he's just observing activities. As an advanced beginner, he's acting with direct supervision in the room. Maybe as they become competent, they can be doing the same thing with supervision available if required. And as they become proficient, they can act unsupervised. And finally, as an expert, they're in fact providing support to the others or supervision to the others. So in our own minds, we can think of our residents going through different stages of all this, and hopefully when they are getting their degree to go out, we're hoping that they've at least reached this level of competency and beyond, and after which they're allowed to practice. This is a busy slide. I'm not expecting you to read it, but I'm just giving you examples. This is from the Royal College, and these are the competencies that they have laid out, and I've just taken one page to give you an example. This is a competency where they have talked about assessing for self-harm of the patient. So competency is a behavior. Competencies can have sub-competencies, parallel competencies, and eventually they are formed from objectives, whether it's called as whether they're called as SLOs or intended learning outcomes. They're basically smaller parts which eventually add up to form the competency. Now, every competency has different parts of it. Like Dr. Kishore just elaborated, knowledge, skills, and attitudes. And you could have a competency which is put in the top part and divided into different sub-competencies along the way, showing how different domains are involved and how you could assess that. So you have a whole host of methods of assessing. This is there. Similarly, if you look at, say, the European framework for competencies in psychiatry, I've just picked up one role as a communicator. And they've talked about how a psychiatrist should be able to, gather and convey information. And based on that, This is an example that they had to have a therapeutic relationship with the patient, one of the few things, and that is one of the competencies, and under that they have various sub-competencies going from 2.1 to whatever it is. And they've again divided further to say, so if that person is to develop an therapeutic relationship with the patient, they would be aware of the factors which influence this. They should know what is verbal and non-verbal communication. Should be facilitate a structured encounter. And to assess all of this, you would be able to assess the knowledge by written or oral examinations. You could be able to do this by clinical examinations. ASCII is something very similar to OSCE. Or they should be able to do it as performance. What Dr. Kishore really talked about is that if you're doing competency assessment, workplace-based assessments are very important. They're happening at the place and you're observing them and then giving understanding whether they're doing it effectively and whether they're competent. And then there are different methods that have been put up here. For example, looking at the documents or doing a multi-source feedback or doing observing the procedures. And there are various such methods, which I won't get into details of, but lack of time, but that this whole gamut would be there. But it's not about just observing bits and parts. For example, I'm giving a clinical vignette. Suppose you wanted to see that person has taken up a treatment plan and he has to communicate it with the carers. How would you assess it? So he would probably go to his supervisor and ask him to assess as DOP is, assessing for his performance of his procedures. Then he would ask, and he's seen a history of a patient with schizophrenia and now is talking to the mother, the psychologist, the nurse, and he's going to tell them about what he's understood about the patient and what is to be done. While he's doing that, many competencies are being assessed that have been outlined. Then people who have been the role play as the patient and the nurse and the psychologist will give a feedback to the resident, telling him how he had behaved on a preformed scale. And this would be a multi-source feedback, which would give him an idea how he has fared in his performance. After meeting the doctor or the resident, will write out a therapeutic plan and fix a date to talk to his supervisor or his mentor, and they will discuss the papers and see whether he had achieved the competency. He will be assessed to whether he had integrated his biological, psychological, and social factors and put the plan down and been able to put it down in writing. So some more competencies are assessed. So while we say that competencies may have different domains, when we want to assess, we have to assess more holistically and not in smaller parts. Remember, the sum is greater than the smaller parts, and therefore assessing in thus a holistic manner is equally important. This is the American system, the AGME, and I've given another example of psychiatric evaluation. They use the Milestones models, and they have, said that at level 1, what is expected, level 2, level 3, level 4, level 5, whether he could gather it, whether he could give appropriate investigations, whether he could interpret the information, whether they could incorporate the risk and protective factors, and whether he could really talk so well, could be a role model for others. So when you're seeing a person, you assess him at which level he is, or he is not yet accessible, or he's even below this level. So this is another framework of how to assess. The idea of showing all this was to give you an idea how competencies are framed and how they can be assessed. But the points to ponder are, therefore, if you have to assess competencies, it has to be robust and multifaceted. The most important is you're going from norm to criterion based. What does that mean? अरे हम एग्जाम में कितने % पास होते हैं? Well, that doesn't work. Here you have to look is whether he or she has reached a predetermined criteria or standard or specification. If they have reached it, they have cleared, or whatever the competency is achieved. So you're moving from norm-based to criterion-based. It is important that you do a lot of work-based assessment so that you observe them directly. For example, even when they do it, when you're seeing them present a history, seeing them take the history is equally important. So observing in action and then being able to assess, so that very important, you will be able to give feedback which is useful in improving and learning for the student. the world keeps talking of how objective the tools are. But remember, it is not only objectivity that matters. Subjective feedback is also very important, especially from senior teachers, because their feedback carries a lot of wisdom and can be equally useful. Finally, also to remember that, trying to assess small bits may sometimes lose its meaning. So to assess holistically also, and to do all of that, resources, you need a lot of those. But what we realized when we saw
Dr. Henal, 2 minutes, please.
Yes, I'll finish in 2 minutes. To realize that when you see all of that, single method is not useful. You need multiple methods, multiple tools, multiple assessors, and multiple times of assessment. Reliability is affected by content. Therefore, you have wide array of methods, and you like a plumber who may come to your house, you'll have to come and check which method is best suitable at that time. And you can tweak the tools that we have. We don't have to throw the baby with the bathwater, all of it. We can choose some of the ways we have and use newer methods. The importance to use multiple assessors and multiple tools is there, because to remove biases and use the strengths and weaknesses of all. This is the Miller's pyramid, and this is where workplace-based assessment occurs. And we have to realize that we have to move from knowledge to actually workplace assessment. And as teachers of postgraduates, we should concentrate on this part of it. To do all of this, you need a blueprint. You need to have a blueprint, and therefore, just like you have a teaching learning plan, you have to also have a plan of assessment, and you have to make a blueprint. And if you have defined competencies, they have to be assessed. Not only have they to be assessed, you have to decide when and how. All don't have to be assessed by all methods, and therefore a blueprint is important. It also depends on the stakes of the exam. A good mnemonic is safer. If you want to have competency-based assessments, you spread the assessment throughout the course with as many assessors, tools, and as many times that you can. Feedback is one of the most important things for a student to learn, and therefore it is not only grades that are important, but narratives that are important. You have to give evidence for all of this. Not only is the student reflecting on what you are saying, but we also need to reflect on what the students learn. And if we have to be empowered, the importance of faculty development is really, really the cornerstone of it. And therefore, I'm looking forward for IPS, ITOP to really work on faculty so that we are up to date in competency-based assessment. Thank you.
Thank you.